Namaste. Mental health in youth is a matter of great concern and is very imperative. Today, we delve into this crucial topic, youth and mental health, as we navigate the unique challenges that this phase of life presents. Today, we have the privilege of hosting Dr. Archanaa, consultant psychiatrist at Apollo Hospital's Greams Road, Chennai. Her expertise and experience will help us understand the challenges our youth face and the strategies to nurture their mental well being. A very warm welcome to our Facebook Live, Doctor. Doctor, speaking about mental health, what are some of the common mental health challenges that the youth of today face?
Some of the common mental health challenges which we come across in our OPDs, the most common is being anxiety, depressive symptoms, addiction, more commonly today, gadget addiction, social media addiction, as well as substance use. Secondary to this, there are stress related issues at school or in the family or in the workplace. These are the common scenarios which we come across in our OPD on a day to day basis.
So, how do we as parents or guardians recognize the signs of mental health issues in our children? It's all about gadgets and playtime and school and activities. How do we recognize the signs and symptoms that the child is facing a challenge?
Yeah, basically, for parents, I would say that a marked change in the behavior of the child or the adolescent. That is, if you can see that the routine or the activity of the child, there is a change in them. Secondly, the sleep pattern. If you find, even though the child is sleeping separately, if you find that the sleep is inadequate, you find this child is very tired in the morning, then it's an indicator that he or she is not sleeping properly. The appetite of the child, the physical activity of the child, you find them too tired or, being less active, not mingling with friends, not smiling as before, being very moody, keeping to self. So all these are indicators that something is happening and maybe you need to, give a closer look on what is happening. On the other side, you can also experience that children have sudden mood swings, mood outbursts. Some parents may rationalize it, telling that it's a part of adolescence and all that. But still, we need to have a closer look into what the child is actually going through, either at school or in college. So there might be some stressors which are happening because of which there is this sudden outswing and outburst of anger, because the most common place where kids show their emotion is towards the parents and the family. So any change here is definitely of market importance.
So, when you say these changes have to be closely monitored, uh, initiating conversations with them becomes very important.
Yes.
So, how do parents or even teachers, for that matter, initiate conversations about mental health with their a teenager or maybe even a youngster?
As far as schools are concerned, I think definitely they should bring mental health into their agenda. Like if schools have moral science classes or moral value classes, they definitely must inculcate, importance of mental health, moral values, coping strategies. So all this should be built in as part of the curriculum. And along with it, sex education. So all this from the school's point of view would be a lot more helpful for children, because when they're hearing these agendas being discussed when their friends are there, it becomes more acceptable to them rather than discussing to them on a one-on-one basis. As far as home is concerned, I think the best way to bring about this topic is by sharing our own experience, or talking to the children about what happened when we were small or we were young, or opening up the avenues of discussion when some news about mental health or some celebrity suicide like recently happened, something like this, when it comes up, that gives another opportunity for us to open away the point of discussions where we can talk about it and slowly get the child tuned or aware of the fact that, when he or she is feeling uncomfortable or he or she is not aware of what is happening, they are confused, they definitely have to voice it out to the parents or to anyone else whom they are comfortable with without ignoring. So these are the channels which we can, make use of to talk about mental health or any other shady topic which the parents usually a bit uncomfortable, to share with their kids.
So, speaking about communicating with our children, how is it different in terms of mental health issues? How does it manifest or how does it differ from an adult to a teenager or a...
The most important difference is a teenager, they are in the stage of transition between a child and the adult. So obviously they are in that state where they want to prove that they are adequate. They want to register the fact to the family first that they are a grown up individual and they can take their own decision. So that's why we have these frequent arguments with teens, and there is points of conflict because they feel what they are doing is right. So obviously that identity, that point of exploration of self is very high in teenagers. So when they come across some mental health issues like anxiety or depressive symptoms, the first thing that strikes them is confusion. They're not aware of what is happening. They think maybe this is part of growing up, or this is something which they have to cross and come, or this is an unexplored avenue which usually not many have discussed with them or they have not seen per se. Then what they do is they do not want to immediately involve the parents because they feel they're adequate enough and they can handle it. So then what happens, they seek the social media, they go into internet, they put down what they're going through, and then they read up all sorts of content, and that makes them even more confused, and some of them actually become more afraid after reading what is on the net, and then they think 100 times whether I should be discussing about this with my parents. Would I scare them by telling this? All those self-doubts come into their minds. And the second thing is, sometimes they may overestimate actually what they're going through. After reading through whatever is in the net, they might try to identify with symptoms which they actually don't have also. So that would become even more confusing. So this is the major difference, because as adult, to some extent, they will know how to cope up and they will have an idea as to what is happening. Whereas teenagers, they would be in a fix and in a sort of, a midway between knowing what actually they're going through and actually what they understand of themselves. So it's very important that they are sort of given a guidance as to how to go about further.
And they also discuss amongst friends.
Yes.
So
yes, definitely.
their experiences of each other's way of handling it is also a remarkable influence.
Yes, definitely, definitely.
Doctor, how important is acceptance when it comes to this kind of mental health issues in children?
Yeah, acceptance is the key word in today's life. So we're talking about acceptance in all spheres of life. So I think it must start from home, and especially the academic institutions. Acceptance is the most important, point. They shouldn't segregate students, or they shouldn't demarcate students. Shouldn't, based on cutoffs or studies or sports, or people who are doing very well, people who are not doing that well, arts, dance. So this categorization must stop. Anyone who's even mediocre should feel that they are accepted into whatever activities happening in the school. Chance must be given to all the kids rather than just focusing on a few kids who are doing well. Especially the academic pressure of only taking the creamy layer and neglecting the backbenchers is another common area. And apart from this inclusion, we are also today talking about inclusion with regard to kids with ADHD, kids with autism, kids who later become teenagers with ADHD, autism. So inclusion and acceptance is the way forward. If not, we would be living in a society where we would have a lot of discrimination and segregation, which will do more harm to our children.
Speaking of social media, which is a big challenge today for parents, what is the role of social media in the mental health of our young generation today?
So social media is something which is not going anywhere. So no matter whatever we do, it is here to stay. So, and it is a double-edged sword. On one side, we find that social media has brought knowledge, skill right to the doorstep of our children and young adults, where they can equip themselves, they can sort of develop themselves, especially for those who are in rural areas. It is a real boon. But at the same time, in this age of risk-taking behavior, wanting to explore new things, sometimes and most of the kids get caught into inappropriate content, and as a matter of fun, they start doing something which later becomes a habit. They get into this peer pressure of either playing games or watching content, which again impacts their mental health. And the age appropriate gaming, again, the parents are not aware usually of what is happening. They're not aware of what kind of games the child is playing, whether it's appropriate for their age, whether it is a violent game, whether it would bring about a lot of mental changes in the health of the child. Like some of these online games have already, we have seen that have caused havoc in the life of many young children, resulting in self-harm and suicides. So parents should be very careful about what the child is seeing. So social media, definitely it has a lot of advantages. At the same time, it is putting a lot of pressure on the kids as well, from a point of being accepted by the peers, and of course validation by your peers, your photos on Insta or Facebook, the likes, the dislikes, the comments. So all this is actually hampering the child's mental health. So even though the child might not be interacting with many, all these comments are indirect feedback to the child. So the child is wanting to take in all this and wants to sort of be a part or want to be part of a community for which she or he starts making changes, to satisfy a particular group of people. That is what we have to, keep a watch on, because the parent should be aware whether the child is doing few things out of her own will or his own will, or they're just doing things to satisfy a group of people. So all these are, very difficult for the parents to also keep abreast, but maybe monitored, supervised screen time could be an answer to most of this.
So, speaking of social media and acceptance, today's children go through a lot of stress, anxiety, for the fact that they want to be accepted, for the fact that they want to be regarded and given importance to. How do we handle this stress and anxiety amongst youth, and what are the effective strategies to manage them?
The most important thing is what atmosphere we provide at home. The communication time, the family time, and keeping social media as definitely a part of the routine, but not a major part of the routine. Focusing more on physical activities, focusing more on reading books, focusing more on relaxation activities, like hobbies with the child likes doing. It could be some music, it could be some sport, it could be drawing, art, any art form. So involving the youth or the young adults, the kids in other activities apart from academics is one major way forward, because their time is being put to proper use. And the second important thing is definitely the sleep time. This is the most important thing, because today gadgets are taking over the sleep time. So one good thing which I recommend some of my patients to do is to keep all the gadgets in one place after a particular time, so that no one at home uses those gadgets, and you can again take it the next day morning.
Including the parents.
Yes, including the parents, because more than whatever we say, it is what we do which the kids are going to follow. So whatever amount of lecturing we do, and then we sit, even if it's for a shorter time, when we sit with the phone, it is like impossible to take away the kids from it. So restricting or zero screen time today might be impossible, near to impossible, but definitely restriction of screen time is possible, for which the parents should also have to restrict their screen time. They should also have to sacrifice their screen time.
So, Doctor, speaking of acceptance and how children are coping up, do you actually see changes that happen in your patients when young people come to you? Do they actually build resilience to cope better with the life's challenges?
Yes. Basically, what happens is, like I already told, the modeling of the parents has a huge impact on the children. So, some young adolescents or young adults who come to us, the problem itself seems to be at home, where they've had a very rough childhood. They've always seen their parents fighting, shouting at each other. So, obviously, the parents are together, they're not separated. But still, the atmosphere at home is not that conducive for kids. On the other hand, we have kids who are also in hostels, and they have some unpleasant experiences there which they have not shared with their parents, and they have been harboring it within them, which has later led to a lot of anxiety, difficulty in coping and all that. So with medications, if they have some sleep disturbance and anxiety issues, and along with that some therapy to sort of go into the actual problems because of which all this has started, and learning or teaching them rather to accept whatever has happened and then to move forward. Slowly they do start learning to accept their past and sometimes forgive their parents also if at some point they feel that it is because of them they have landed here. So all this has happened through our journey with a lot of youngsters.
Doctor, do these kids go through trauma? And is it the same as a challenged mental health problem? And how does trauma informed care, for that matter, can actually make a difference?
Is some of these adolescents do go through trauma, like they go through trauma in the sense that it is not a single incident. Most of the time what is happening is over a period of time they see something repeatedly happening over a period of time. For example, one of the parents, either of the parents, just shouting at them for no fault of theirs, or there's alcohol use or substance use in any one of the parent, and the child gets beaten up, or the child is sort of shuffled between both the parents. So this is real trauma for the child, and when it is sustained over a period of time, two things can happen. One is the child can just become numb to all emotions. They can get totally withdrawn within themselves, become not interacting with others, just keeping to their work, doing the bare minimum, not wanting to face anyone because they're not bothered about anything else. They feel that can happen. That is one way. The other thing is they can become explicitly, what to say, outgoing. They might have a lot of risk-taking behavior, self-harming behavior, substance use, violent aggression, wherein they feel that now it is their time, they are physically grown to give back what they have received, kind of. So they can be in both these varied spectrums. So bringing them back to normalcy will take time and lot of effort.
And professional help as well.
Definitely professional help, and healing of the trauma would definitely take time, but would cause major changes in the life of that particular person.
How can we encourage young individuals or youngsters today to overcome the fear of reaching out for help, doctor, when they're actually struggling?
Yeah, that is exactly one of the agendas of why we are doing the program. Awareness is the most important thing today. So, especially because youngsters are the major chunk using social media, awareness through social media platforms, awareness programs created by schools. The schools should definitely take up programs on mental health, so that there is some sort of input given to the students that something can happen if they have an issue. There is some person to whom they can go and actually approach. Just giving them that idea itself will go a long way forward. And even a lot of offices, a lot of colleges are doing programs on mental health. They are inviting professionals to talk to students. They have individual schools have counselors, but the other thing is they need to be more trained as to how to handle these children who come to them with their problems. The first thing, of course, is to never be judgmental towards any adolescent or young adults who comes to you with a problem, even if you are not a counselor. Because the moment the first person to whom they go to becomes judgmental, they are not going to go to the second person. They're not going to share what their problems are. So definitely creating awareness, avenues, programs, getting to educate the youth about mental health is one major step forward.
Doctor, this year's theme is mental health is a universal human right. Like you mentioned, that children should let go of the fear and communicate and come out and speak. So, what is your view on this, doctor?
Yeah, this year's theme itself emphasizes the importance of humans' mental health all over the world. So WHO has adapted it as a human right, which shows what impact it is having on the entire development of the human race. Because today we see suicides are increasing at an alarming rate, especially among young children, among young adults. Young adults, the suicide rate has been doubling and tripling in our country. So the need of the hour is we need to redefine success. We need to teach our children that success is not academic, success is not money, success is not fame. It is just about being yourself, being physically and mentally healthy. And we should start probably sharing failure stories where the children know that failure is part of life. We need to start normalizing failure so they know that they can cope up when something wrong happens. Parents should be supportive. Parents should more often talk to the children about what happened to them, what were their hazards, what were their failures, after which how they've come up. So all these needs to be spoken more. We are more concentrating on success, fame, money. So we're indirectly as a society putting so much of pressure on our younger generation, to the extent that they feel it's better for them to not be there rather than to survive this pressure. So as a society, I think we need to rethink, our definition of success.
We'll take some questions from our viewers, doctor. As a parent, how can I support my son who's dealing with anxiety disorder and clinical depression?
As a parent, what the first thing which we need to do is just be with the child. Just be with the child. There's no need to overprotect the child, because that will again cause more anxiety. Just be with them, talk to them, uh, make them feel that it's okay for them to go through that particular phase, and you have also been there sometime in your life, and it is something which will pass through, and you will be with the child irrespective of whatever the outcome is. And when you get to know there are few triggers because of the which the child is becoming more anxious, try to address those triggers. It could be personal, it could be academics, it could be anything. So if you're able to address those triggers, then automatically the anxiety in the child would also come down. And try to maintain a routine with the child, take care of his sleep, his food, his gadget usage, regularize his school going or college going, give him a proper playtime, physical activity, get him involved in other things, and encourage him to do what he likes. Maybe this is the least which all the parents can do in supporting their children.
I'm deeply concerned about my friend who recently got laid off from her company. What are the signs of emotional distress in her that I should be aware of, and how can I offer to support her?
Again, this we very commonly saw, during COVID and post-COVID, layoffs, and young people who were very ambitious getting laid off from their jobs. So what is it we should look out for? We should always see to it that they're not alone. The family at the outset shouldn't start blaming them for getting laid off. You should always not blame them, telling that you were incompetent, because of which when they didn't lay off other people, they laid off only you. So all these things has to stop, because something has happened, and by telling them that they're not good, you are not actually helping them. So if it is a friend, obviously help him or her in getting another job. If you genuinely feel that she or he needs to develop her skills because of which the layoff has happened, make a meaningful conversation with them and encourage them to develop those skills, so that they will it will help them in their subsequent job. And go out with them. Don't allow them to be alone. If you feel that they're a bit down, go out with them. Try to keep them in a happy mood. It's better they stay with their family, if the family is a supportive family, so that there is always someone around them. So and always make them feel it is just a temporary phase, and there's always going to be some job which she or he is going to take up. Until then, they'll have to survive this in order to get there.
My daughter is in her 12th standard and is facing academic pressure, the fear of exams, and I want to ensure that she maintains a healthy mental balance. She becomes sad at the drop of a hat and does not talk much during or before exams. What steps can I take as a parent to help her manage stress?
So the most important problem here is the fear of the results. Like, even before the exam starts, even when you're entering the 10th or 12th grade, the major reason for anxiety and for these kind of mood swings is what would happen if I do not score well. So that is the main question. And everyone at home constantly talking about the 12th exams and the results, whomever visits also, inquiring about the same thing. So this is indirectly mounting up so much of pressure on the child. So the first thing is, you need to take that fear of the result out of the child's mind, for which as parents you need to sit and talk to the child what she actually wants to do, which field she wants to go to, and what are the other fields available, for which the parents should first have a broad view of all the available opportunity in today's world, rather than just restricting themselves to one or two professional courses. That is the most important thing. And then you must always let the child know it is never only a plan A. There is always a plan B and plan C. You should always let the child know that she would be doing well, but in case something goes wrong and there is a slight dip in a marks, or if something like that happens, that is not the end of the world. They should always let the child know there are still further opportunities. There are other opportunities which the child would get, or there are other avenues which would be more suitable for her. So discussing all these things would make the child a little more comfortable that her life is not dependent on the results. So most of the time when that idea gets into the child's mind, this mood swings and this anxiety would reduce, because the more stressed the child is going to be, even the studying would become difficult to the child. So because of the stress, she will require more time even to study something which takes very less time. So definitely the parents' conversation with the child right from the beginning, this has to happen not just before the exams. It has to happen through, maybe probably even from the 10th. So the child is, morally equipped to face the exam and is not afraid of, the results.
Today is World Mental Health Day, Doctor. What would be your message for our viewers today?
Yeah, on this World Mental Health Day, I would say that look around. There are so many people around us who are going through so much. So start accepting people. Don't jump to conclusions. Don't be judgmental. And especially if you are a parent, definitely listen to your child. Put the phone away, switch off the TV, listen to what he or she is telling, because nothing else is going to change your world rather than you listening to your child. Because definitely, if the child is coming up to you to tell something, it is important. If today you're not going to listen to that small thing, tomorrow the child is not going to come and tell you any major life event or something which is scaring the child. And this applies not only to the child, even to our colleagues, friends, parents, and others. When someone is taking the time to come up and tell you something, please do listen to them. Definitely use social media, but with restrictions. Thank you.
Thank you so much, Doctor. You helped us understand the challenges that our youth are facing and also the ways in which we can help. We can be a safe space for them.
Definitely, definitely.
For appointments with Dr. Archanaa, a clinical consultant psychiatrist at Apollo Hospitals, Greams Road, Chennai, please contact 044 4040 1066. I repeat, 4040 1066. Thank you very much, Doctor. Thank you, viewers.